Welcome to ProZBio.
The U.S. Food and Drug Administration has approved the first-ever treatment for cerebrotendinous xanthomatosis, called CTX. This is a groundbreaking moment for patients suffering from this rare and debilitating genetic disorder. CTX offers new hope for managing CTX symptoms and improving quality of life. This approval marks a significant step forward in the field of rare diseases. It underscores the importance of continuous research and development in finding treatments for conditions that have long been overlooked. For years, individuals with CTX and their families have faced a challenging journey with limited treatment options. The arrival of CTX signifies a turning point in CTX care. The FDA's decision to approve CTX was based on compelling clinical trial data, demonstrating its safety and effectiveness. This approval paves the way for a brighter future for CTX patients. Cerebrotendinous xanthomatosis, or CTX, is a rare genetic disorder that affects approximately 1 in 100,000 people worldwide. This condition leads to the accumulation of cholesterol and cholestanol, a type of fat-like substance in various tissues throughout the body. The buildup of these substances primarily occurs in the brain, tendons, and eyes, leading to a range of debilitating symptoms. These symptoms can significantly impact an individual's physical and cognitive abilities, ultimately affecting their quality of life. CTX is a progressive disease, meaning its symptoms tend to worsen over time if left untreated. Early diagnosis and treatment are crucial to managing symptoms and preventing irreversible damage. The rarity of CTX often leads to delays in diagnosis, as its symptoms can mimic other more common neurological conditions. Raising awareness about CTX is vital to ensure timely diagnosis and intervention. At the heart of CTX lies a mutation in the CYP27A1 gene. This gene plays a crucial role in producing an enzyme responsible for breaking down cholesterol and cholestanol. When this gene is mutated, the enzyme's function is impaired, leading to the accumulation of these substances in various tissues. This buildup is the root cause of the various symptoms experienced by individuals with CTX. The CYP27A1 gene mutation is inherited in an autosomal recessive pattern. This means that a child must inherit 2 copies of the mutated gene, one from each parent, to develop CTX. Individuals who inherit only 1 copy of the mutated gene are known as carriers. They do not typically develop CTX but have a 50% chance of passing the mutated gene to their children. Genetic testing can confirm the diagnosis of CTX by identifying the presence of the CYP27A1 gene mutation. Early genetic testing is particularly important for individuals with a family history of CTX. CTX, known generically as chenodiol, is a medication that has been FDA approved specifically for treating CTX. By increasing the production of bile acids in the liver, CTX helps reduce the buildup of harmful cholesterol metabolites in the body. This mechanism of action addresses the underlying cause of CTX, offering a promising approach to managing the disease. CTX represents a significant advancement in CTX treatment, providing patients with a much-needed therapeutic option. Clinical trials have demonstrated that CTX can effectively reduce cholesterol and cholestanol levels in individuals with CTX. These reductions have been associated with improvements in neurological symptoms, such as balance and coordination. Moreover, CTX has shown promise in slowing the progression of CTX. Early initiation of treatment with CTX may help preserve neurological function and improve long-term outcomes. Section 5. Chenodiol, from gallstones to CTX treatment. Interestingly, chenodiol, the active ingredient in CTX, has a history dating back to its initial approval by the FDA in 1987 for treating gallstones. This previous use highlights the versatility of certain medications and their potential applications in different medical conditions. While chenodiol's mechanism in dissolving gallstones differs from its role in treating CTX, its ability to influence bile acid production proved to be beneficial for both conditions. This discovery underscores the importance of exploring existing medications for new therapeutic purposes. Over the years, physicians observed that chenodiol also showed promise in alleviating symptoms of CTX, leading to its off-label use for this purpose. This off-label use provided valuable insights and paved the way for further research and development. ultimately leading to its FDA approval for CTX. The journey of chenodial from treating gallstones to becoming the first FDA-approved treatment for CTX is a testament to the evolving nature of medicine and the importance of continuous exploration in drug development. Section 6. The challenge of CTX diagnosis. Despite its debilitating nature, CTX often flies under the radar, making diagnosis a significant challenge. The rarity of the disease, coupled with its wide-ranging symptoms that often mimic other neurological disorders, contributes to frequent misdiagnosis or delayed diagnosis. Many patients endure years of uncertainty, undergoing numerous tests and consultations before receiving an accurate diagnosis. This delay in diagnosis can have detrimental consequences, as early intervention is crucial for managing CTX and preventing irreversible damage. Adding to the complexity is the fact that CTX symptoms can vary significantly from person to person, even within the same family. This variability makes it difficult to establish a clear-cut diagnostic pathway based solely on clinical presentation. Raising awareness about CTX among healthcare professionals and the general public is paramount. Educating doctors about the subtle signs and symptoms of CTX can help improve diagnostic rates and reduce the time to diagnosis. Section 7. Navigating CTX. Before the FDA's approval of CTX, managing CTX primarily revolved around alleviating individual symptoms and providing supportive care. Treatment options were limited and often focused on addressing specific issues rather than targeting the root cause of the disease. For instance, cataract surgery was a common procedure for patients experiencing vision problems due to cholesterol buildup in the lenses of their eyes. While this addressed the immediate issue of impaired vision, it did not address the underlying cause of the cataracts. Similarly, medications were prescribed to manage neurological and psychiatric symptoms, such as seizures, movement disorders, and behavioral changes. These medications provided symptomatic relief, but did not alter the course of the disease. Lifestyle modifications, such as following a low-cholesterol diet, were also recommended to help manage CTX. However, these modifications alone were often insufficient in controlling the progression of the disease. Section 8. CTX, side effects and precautions. As with any medication, CTX may cause side effects in some individuals. Common side effects include diarrhea, headache, stomach pain, and muscle weakness. These side effects are typically mild and tend to subside as the body adjusts to the medication. However, it is crucial to note that CTX can potentially cause liver problems. Therefore, regular liver function tests are essential for monitoring patients taking this medication. Before initiating CTX, patients should inform their healthcare provider about any other medications or supplements they are currently taking. This information allows the healthcare provider to assess for potential drug interactions and adjust medications accordingly. Pregnant or breastfeeding women should consult their doctor before taking CTX, as its effects on pregnancy and lactation are not fully understood. It is essential to weigh the potential benefits of treatment against any potential risks to the mother and child. Section 9. Early diagnosis, the key to combating CTX. The approval of CTX marks a pivotal moment in the fight against CTX. However, its effectiveness hinges on early diagnosis and treatment initiation. Recognizing the subtle signs and symptoms of CTX and seeking prompt medical attention is crucial for improving patient outcomes. Early diagnosis allows for timely intervention with CTX, potentially slowing disease progression and preventing irreversible damage. The sooner treatment begins, the better the chances of preserving neurological function and improving quality of life for individuals with CTX. Healthcare professionals play a vital role in raising awareness about CTX and promoting early diagnosis. Educating other healthcare providers about this rare disorder can help facilitate timely referrals and ensure patients receive appropriate care. Increased research funding for CTX is essential to further our understanding of the disease, develop more effective treatments, and ultimately find a cure. Supporting ongoing research efforts is crucial for advancing the field and improving the lives of individuals and families affected by CTX.
Thank you for watching. Please subscribe to our channel for more interesting topics. You can also visit us on social media or our blog website. The link is in the bio.